Good morning, and the most awaited discussion of the APPG paper. This used to be a very historical discussion in the yesteryears, but now the paper given to home and the Right of Information Act of Transparency has enabled the things become much better. Now, I still remember my own experience of taking the AP entrance and having a bereavement reaction for almost 10 days. Arey, this went wrong, that went wrong, that went wrong, this went wrong. So don't worry about what went wrong, because everybody did wrongs. You are not the only one who did simple mistakes, let me tell you. For example, I have given this paper, some of the questions to some of the very good teachers. Even between two teachers there is a difference of opinion while answering in a blinded manner. So at the level of consultant only there can be errors which can happen, so that's the reason nothing to worry. Now the question comes, $1 million question for everybody is it a tough paper or an easy paper? I should say that 170 questions didn't exist. The real exam is only between 30 questions, which will decide whether you are there within the 100 or not. But if that is the bad news, the good news is, those 170 questions also people will be doing suicidal mistakes, which is a good news because it's called error of commission, whereas the remaining 30 are the error of omission. So now the question is, how minor was your error of commission and how major was your error of omission will decide the ultimate outcome. So winning and losing, doc, is only a relative performance of others over us at any point. Let's make the start. Intra-arterially what? Which is the drug that you can administer? If you are doing atherectomy, you will be injecting 5000 international units of heparin intra-arterially. So that is the reason heparin is very well known as a drug which is administered intra-arterially is what we should basically appreciate. Now, which is not a component of airway maintenance. I said this is definitely a tricky question. Tricky in the sense, head tilt, chin lift. Most reliable method of achieving relieving the airway obstruction. Everyone agree that. Do we pull the tongue really by doing the basic life support, BLS? The purpose of basically elevating the jaw, lifting the jaw, is to indirectly cause the tongue pull away from the airway, but directly we don't do that. So shall we call D as the answer? But what is the competing option? How about the jaw thrust? Jaw thrust is one of the ways by which airway obstruction is relieved in the traumatized patients basically. See, you may have two kinds of patients. Patients who had trauma with airway obstruction, without trauma with airway obstruction, who are comatose. So jaw thrust is mainly used in the patients who had trauma. So that is the reason, doctor, jaw thrust in the modern protocols of BLS, basic life support, had been removed. It is no more made those airway maintenance maneuvers in the modern protocols of BLS. By that logic, jaw thrust should be answer, but otherwise the tongue pull will be the answer. Another 5 to 6 hours we will know what examiner had in his mind framing the question, but I would say D more likely than that of the B. Now, what is a naturally occurring opioid? Very simple question. You know that naturally occurring opioid include phenanthrines, which are morphine and codeine, and threonine compounds like papaverine. Then synthetic opioids fall into mainly 4 groups, which include levorphenol, methadone, pentagocine, and meperidine, fentanyl, remifentanil, sufentanil, alfentanil, etc., etc. So this will be answered by, this comes in that 180 questions, 170 questions. Easy to answer, and we all know that pentagocine, which we use in the anesthetic wards, etc., anesthetic rounds, etc., is fundamentally a synthetic one, not a naturally occurring one. Propofol, the milk of amnesia, it is called as. This had been one of the very old traditional topic. There is no surprise about it. It caused less nausea than the other opioids, which are also used as the analgesic and anesthetic agents. It can cause myoclonus. It has no active metabolites. It can be used both for short-term and long-term amnesia also at the time of anesthesia. So they are all true about propofol, which is used in the daycare surgery. Only thing is, it will depress the respiratory rate. That is the reason it has a chance of inducing respiratory acidosis, respiratory acidosis. And propofol is also known to inhibit the mitochondria. That's the reason it can rarely lead to metabolic acidosis, not alkalosis. So metabolic alkalosis always is a state of dehydration. What is the reason for metabolic alkalosis? Generally, excessive aldosterone. Excessive aldosterone will lead to retention of sodium and potassium, sodium and loss of K plus and H plus into urine, and that lead to alkalosis. That excessive aldosterone can be because of any adrenal adenoma, or it can be in a dehydrated person, secondary hyperaldosteronism can be there. So that is the reason dehydrated people will have metabolic alkalosis. Simple thing to remember, those who have a decreased intravascular volume, their renal plasma flow will decrease and they produce excessive aldosterone. So no way that propofol lead to metabolic alkalosis, so that becomes the answer. With regard to the coronary sinus, I don't want to see any other options, no use of debating. Option D is straight away evident for us. One of the very characteristic feature about the coronary venous circulation, all the veins, middle, small, great and oblique cardiac vein, they all basically drain into coronary sinus, but the anterior cardiac vein will be draining into the right atrium is what you have to fundamentally, directly into right atrium. It won't drain into coronary sinus. That is what we need to fundamentally appreciate. From where does long head and short head of triceps originate? Long head from the infraglenoid tubercle of the scapula, and the medial head arises distally from the groove of the radial nerve. So that is the reason it is the infraglenoid tubercle of the scapula is what we have to fundamentally appreciate. Now posterior femoral muscles, who is the one who provides the blood supply? I can say this falls in the 30. Generally we don't expect it. If luck favors, we answer correctly, or our elimination scale is very high. If our elimination skills are very high, then we can answer it correctly. So doctor, there are basically 3 perforators. 3 perforators that perforate the tendon of the adductor magnus, and in this the second perforating artery of the profunda femoris fundamentally it will be dividing into ascending and descending branches, and they supply the posterior femoral muscles, and after doing so they will be anastomosing with the first and third perforator. So that is the reason it is the perforating branches of the profunda femoris which supply the posterior femoral muscles is what we have to basically appreciate. Oh, this is the biscuit question. Stapedius, second branchial arch, seventh cranial nerve. People are unhappy if the paper is tough. People are unhappy if the paper is easy also. So that is called status epilepticus, non-convulsive. You don't have convulsions, you are in a fear psychosis. And examiner will declare the result exactly on 12th day. There is a significance for 12th day. If somebody dies on 12th day, they conduct the last day of Nitya Karma and say goodbye to the soul. So 11th is the exam, 23rd. Suddenly somebody was saying, when will the result come? How long we need to hold this tight bladder? So they said, slowly we will be releasing the bladder, because first we will release the key. Next we will tell how big the cohort is, the people who got themselves fooled in answering. Finally we will declare your result. So this is 12 days of agony and bereavement. That's the reason take a vacation after the discussion. Now what are the contents of femoral sheath, doctor? This is the easy question. If this is also done wrong, come and join free for our next year coaching. We will take responsibility, social responsibility of training you. So doctor, femoral vein, femoral artery, lymph nodes, not the femoral nerve, is the content of the femoral sheath. It has got a lateral compartment where there is a femoral artery, intermediate compartment where there is a femoral vein, and the medial compartment, which is femoral canal, which will be homing the lymph nodes, is what need to be remembered. Now comes our glutes. Glut 1, glut 2, glut 3, glut 4. So in exam hall, if we know answer, easy, but otherwise the heart will be pounding and racing around. So doctor, glut 4 is called insulin regulated glucose transporter, which is being found in the adipose tissues and skeletal muscle tissue, is what need to be remembered. This is the cheapest question. Niacin is 5-hydroxytryptamine produced from the tryptophan. This comes under that 180 bunch. Porphyria in lead toxicity. Very easy question. One among those 180.